Hi everyone, this is Vincent. I work at Eureka Therapeutics, and today I will have a short demonstration of what are safety guidelines and how we would like to do GLP when entering the lab. So the first thing is I want to cover the basics. The basics is to make sure you come to work as clean as possible. It's basic hygiene. Come to work with your hair and your body clean. Second one is to remove any unnecessary items. Those could be jewelry, any electronics, or even makeup. The third one is to try to avoid any contact of surfaces before you gown up. And if you do, try to wash or sanitize your hands right before you gown. And then the next thing is we're gonna go from basics into the GLP practices. And that will include what we do when we enter the lab, how to gown, how to sanitize your area, and at the end of the day is how to dispose and then re-sanitize your area again. Hi, now we're in the lab, everyone. So what I want to explain is before we enter in the lab, some people may have face masks on already. For now, I'm not going to do that. I will show this demonstration without the face mask, but we're going to go over that later as we get into all the PPE. So one thing that we would like to enforce, and I highly suggest, is to keep the 6 feet distancing from each person as you are in the lab. I know it's difficult to do, but try to do it as much as possible. So we have hand sanitizer here that you can always use when you enter. You can use that, but we would try not to use it as much as possible because sometimes we're going to get a load shortage. So I'm not fully gowned, so the next thing I need to do is grab your PPE, which is your personal protective equipment. So I've placed my PPE there, which is my lab coat and gloves and face mask. What you want to do first is to fully sanitize before you gown. So we're here at the sink. Make sure you turn it on. Get your hands a little wet. Get some soap here. Get some here. Get a little, and you want to make sure you lather all the way in your hands and up to your elbows. Once it's fully lathered, just want to rinse under here. You do at least a minimum of 20 seconds. Okay, you could maybe count in your head, or just try to keep wet and washed until it's fully washed out. Kick, just turn that off, shake out the excess, dry. I will come over here to my workbench. So after you have washed your hands thoroughly, we want to put on our PPE. I have my lab coat here, gloves, make sure it's the right size, and I have my face mask. So like again, earlier, some people may have their face mask already as they enter the lab, which is totally fine. I'm going to show you a demonstration as if you came into the lab without your mask. So put on your lab coat first. Make sure it's the correct size also. One other thing is to make sure you check the integrity of your gloves, your lab coat, and the face mask that you'll be using. So any of the PPE that you would be using. Check the integrity by seeing if there's no holes, make sure it's clean, no damages or defects. I'm gonna put this after. So you wanna first put your lab coat on, and you wanna grab some gloves. Again, these gloves are in a big box, so it's not totally sterile. So I always suggest to spray ethanol again after you wear them and put them on. So I got them on, some ethanol, wipe it down, make it dry a little, and now I'll put on my face mask. This one's a P95. There are also surgical masks. Those are a little bit more trickier to put on than the P95. It's just more intuitive for these guys. I already put it on backwards. So this part of the P95, where it should have a metal piece, that should be always bridged over your nose. And you want to make sure everything is totally covered. There's no openings around the side. And the bottom of the mask is fully covered under your chin and in your nose, and there's no opening. Okay? Now that I got all my PPE on, my gloves, my lab coat, and my face mask, and there is also some times where you need eyewear. So right now I'm not going to be using eyewear, but that's another option. If you need to wear eyeglasses for certain experiments, make sure you also wear those. I have all my PPE on. Next step is to do the basics of your workbench area. So the first thing is to remove any unnecessary items. So these stuff I need. Move any of these things out of your way, out of the way you're working, and it should be all clear and clean. After you remove any unnecessary items, you want to grab your 70% ethanol, and there's a couple of things that you want to spray down. One main thing is, of course, your bench top. Spray it all around, especially in the area that you'll be working in. I like to spray a little bit further out. Wipe it all down. Make sure it's totally clean. Sanitize. Then, next item is going to be your chair. And of course you can do this in any order. Just make sure you sanitize your whole workbench area or wherever you're working. Okay. And then the next items are going to be your pipettes or any of your equipment you'll be using. And this is going to be done always before you start work. This is a practice that's really good, and it's kind of done naturally once you get started. Now all your pipettes you'll be using. Once all of those are all wiped down, you have your bench top, your chair, my equipment that I'll be using, all sanitized now. And lastly, you want to spray your hands again with ethanol. Spray your gloves. Make sure you rub it all the way in. Make sure it's all clean because you just wiped down everything and your gloves may be dirty. And now that I re-sanitized, I'm here and I'm ready to begin. Okay? PPE, sanitize, sanitize. Okay, so this portion of the demo is going to show or explain how to dispose any of your waste and re-sanitize at the end of your day or at the end of your time you're in the lab, okay? So I'm done with work. What we want to do is remove any of your waste and dispose of it. So I'm going to move all of these items because this is stuff I need. These are items I don't need. Throw it away. Apparently my bench is very clean already, so I don't have many stuff to dispose of. But I'm going to make sure it's all disposed of. Most of the time you'll have these receptacle bins, and it should have a plastic, or if it doesn't, just make sure you remove all of your items and dump it out, okay? So that's empty, and if this had a plastic bag, you want to replace it with a new plastic bag. After you dispose all of your items and remove anything that is not needed, then you want to re-sanitize. Again, you're going to be doing the same thing that I showed you. You want to do your bench top. Wipe it down. And then the next item is going to be the chair. I do it in this order, but you can do it in any order you like. It's just, I feel like it's cleaner this way. Most of the time, your equipment's dirtier than your chair. Or that one is just not right down. Now, bench, chair, and then next your equipment. All by my bed. Wipe down thoroughly. I always wipe it along the shaft and at the handle. And we will be performing this at the end of the day all the time. So it's always being sanitized and then re-sanitized before and after you come into work. And there's going to be some times when you're going to be working in an area, maybe you are going to be done with it, and then you would come back in maybe an hour or so. In that situation, I would suggest to actually dispose and re-sanitize again.